Fractures of the spine can happen even without a fall or an injury. Each year, osteoporosis is the cause of 1.5 million fractures, of which 700,000 are osteoporotic compression fractures. Dr. David Duffner of Desert Regional Medical Center in Palm Springs explains the newest procedures in repairing these fractures.
There are different types of spine fractures. Some spine fractures occur as a result of high energy, like a car wreck or a fall from a height. However, other spine fractures occur as a result of osteoporosis. And in that case, basically the spine is just not strong enough to support the load that's applied to it. The occurrence of osteoporotic compression fractures ties very closely to the incidence of osteoporosis. And so we see that beginning to appear in women at about age 55. Typically, adults will lose about 1% of their bone mineral density per year after age 30. And you have enough calcium stored in your bone that it doesn't manifest for 20 or 30 years. But as you lose more and more calcium from your bone, the structure gets weaker and then it can collapse. Well, the primary symptom, of course, is pain. Anytime you have a broken bone, it's very painful. So the primary symptom is pain. Now, as far as the location, it depends on which vertebrae is involved. And so throughout the thoracic or the lumbar segments, it can be any vertebrae from about the mid-thoracic around T5, clear on down to the lower lumbar about L4. So you've got about a dozen or so vertebrae that can be affected by this condition. The diagnosis is relatively straightforward. I say relatively because if you have a broken bone and you have an x-ray, then that leads you to the diagnosis. However, it's not always that simple. So we have other tests that we run, most commonly an MRI scan. If we establish the diagnosis early on, we're able to do a new minimally invasive procedure through a very small incision with lower risk and quicker recovery times. That procedure is called a vertebroplasty or a kyphoplasty. They're variations on the same thing. And basically what we do in that procedure is, the idea is very simple. We take an instrument and make a small incision in the skin, with the patient asleep, of course, and then we put an instrument into the bone, like that. And then once that pin is in place, and we use an x-ray machine to determine the exact placement, once that pin is in place, then we put a hollow tube over that pin, and then we can take a little bit of bone cement and inject it through the tube into the vertebral body. The bone cement fills up the cracks and stops the motion of the fracture and therefore stops the pain. Well, the procedure itself takes less than an hour, and the rehab is very simple because the bone cement becomes hardened in about 20 minutes. That's it, you're done. Typically when the patient wakes up in the recovery room, the pain is gone. We use a little bit of local anesthetic where we make the incision so they don't feel the incision pain. And they wake up and it's like a miracle. The pain is gone. And so the rehab is very simple. We have a physical therapist come by and make sure they can get up and walk safely. And when they feel comfortable, usually the next day they go home. In this procedure, it's really kind of fun for me because it's quick, it's easy, the patients respond very quickly, there's not a long recovery time, and it's some of the most happy and grateful patients that I've had.